Trade Union Solidarity says it's preparing for a major court battle to challenge the National Health Insurance Bill in its current form. The National Assembly passed the bill on Tuesday, paving the way for the introduction of universal health care for all South Africans. For more on this discussion, we are now joined by Peirru Marx, a medical sector coordinator at Solidarity. Mr. Marx, thank you so much for joining us this evening. Now, Mr. Marx, the bill in its current form seeks to give universal access of proper health care to all South Africans, especially those who can't afford it. Why would you be opposed to this?
Well, let me first start off by saying good evening. Look, from our side, government claims that the NHI will basically enhance healthcare and that everybody will have equal access to quality healthcare. But that's simply not the case. Just nationalizing private healthcare, having a funding system that is claimed to now being utilized by both private and government institutions is not going to help us move forward. Government needs to start paying attention to the numerous stakeholder inputs. We have been participating in these processes. And it's not only Solidarity, it's numerous institutions that have indicated that it simply cannot work, it's not affordable, and, the most important thing that you need to consider, you need to take into consideration the economic status. You need to understand the level of corruption that's in these public institutions, and having a paper or a law is simply not going to change that.
Now, earlier on, Newzroom Afrika spoke to the DDG in the Department of Health, Dr. Crisp, and he says that it's not true that the NHI seeks to exclude the private sector, and that it's also not true that the Department of Health is not working on strengthening the current issues that exist within the public health sector. Are you still opposed to that?
Yes, we are still opposed to that. Even if you listen to his explanation saying that other countries are taking 60 years and 15 years and even longer. I mean, we read just a few weeks ago that government was behind about, I think it was around about 170,000 operations. The main issue here is that infrastructure is not maintained. They're not addressing staff shortages. Once again, a legislation is not going to deal with those type of issues. You need to understand, if you look at our staff complement in the public sector as well as private sector, we're sitting with 0.3 doctors per 1,000 individuals. We're sitting with 4.6 nursing per 1,000 individuals. With looking at health care practitioners, we're sitting with a deficit of about 60,000. So if you start looking at these numbers, how do you support a national system when you don't even have the support of this, the numbers in staff? We're supposed to be around about 8.5 nursing staff. I mean, per 1,000. We're not even close to that. We don't even have to go into detail as to why these numbers are so low. But even from our side, the research that we've done in Solidarity Research Institute has shown that doctors have indicated they're not willing to work under NHI. Most of them have worked overseas under NHI, and they simply say the system doesn't work. And now government wants to now go and claim them, the medical practitioners for themselves. And part of this legislation now basically gives government centralized power all of basically the whole health sector. And they will dictate where you can practice. They will dictate how your practice must be run. They will dictate what services you can render. We don't even know what services will be rendered under the National Health Insurance. And then the next thing is then the funding. Where will the money come from?
Speaking of the money, what effect do you think this would have on our fiscus?
You see, the main thing that you need to understand is to nationalize private healthcare, it means that's about 17% of the country that's actually taking care of private sector, and obviously the rest is a public sector. So if you take into consideration now, countries with much stronger economies than South Africa is struggling to run a national health insurance. Now the act, it does make opportunity for supplementary funding, but obviously supplementary funding will have to come from somewhere. That will be a more taxation, basically putting more burden on those taxpayers that are already under the economy and all the challenges that we've been facing over the years. And then obviously, like I said, putting legislation in place and saying that you need legislation to run a national health insurance. My question would be then, what about the mismanagement of the public sector? how are you going to then address those? Because that hasn't been addressed for years. It's actually gone backwards. And, you cannot simply now go and say that, a legislation will now basically fix those, mismanagement, corruption, all of the issues, having the right people in place to actually manage the healthcare system. Those are all issues that is still there. It's not changing. No one has been changed up there to basically make sure that even the current system in the public sector is being run efficiently. If you do that properly, obviously patient care will be enhanced. You can start dealing with the backlogs. You can start dealing with all of these issues. I still remember during the COVID days where the president himself said that there will be proper oversight. There will be no corruption of the money that will be, for the funding of the healthcare system during COVID. And that was simply not the case. We know exactly what happened with the money and this is just this is still, NHI is not healthcare. This is a funding model. That means that fundamentally you'll have to apply for funding, and then out of that funding they will provide healthcare. The private sector simply does not have the capacity to deal with the whole of South Africa. And now you're still sitting with those healthcare facilities. You're still sitting with the substandard facilities that's out there, and it's still not going to change all of that. So those are the big challenges we're going to face as a country. And obviously the burden is going to be on those that still have a work. I'm taking into consideration that taking the almost 40% unemployment. So those are all the issues and challenges we're going to face.
Mr. Marx, in accordance to solidarity, there seems to be more cons than pros to this bill. Why do you then believe that the government is still pushing for it to be implemented?
Well, from our side, I can only see the fact that government has failed in all the government institutions thus far. The only thing that they still have to offer the South Africans is free healthcare. And I believe that it's because of the poll stations next year, and next year is another voting day. And, I think promising people to have access to quality healthcare will give them that extra cross during the poll stations.
And if we look at the numbers in terms of medical aids in South Africa, only 16% of our population seems to have access to medical aid schemes. 73% of that 16% is white individuals, 52% are Asian individuals, and 10% are black individuals. This is clearly indicating a racial disparity in terms of private healthcare. Do you believe that the NHI bill will still not meet or bring together that gap that is existing, especially with regards to those that can afford proper healthcare services?
You see, that just referring to your last bit of saying proper healthcare services, everybody has got access to healthcare in South Africa. That's why you have a public service. The issue here is having access to quality healthcare. Now, having a bill and having legislation is not gonna basically ensure that people will have access to quality healthcare. The issue here is the fact that the public health sector has basically over the last years simply eroded. It was not kept up to standard. The issue is that the staffing has been a constraint. This was clear during the COVID days. People were calling back staff to government institutions, having to deal with the brunt of COVID, and they simply didn't have the staff resources. You would remember that during COVID, most of the private healthcare services that did not deal with emergencies were closed. They were not even operating. Even during this time, you would still remember that government actually brought people from outside of South Africa to the detriment of our own professionals, claiming that they were experts dealing with COVID. And those are all issues that are still fresh in our minds. This is not going to change. My phone has not been stopped ringing since the legislation has been passed through Parliament. And people are simply saying, and those are healthcare practitioners and specialists working in hospitals, saying they will not work under NHI. Even Solidarity have done research in the past and through our Solidarity Research Institute, and they simply said we will not work under NHI. We will basically leave South Africa because they can't work under such conditions. They know what the challenges are in the public sector, and this is why government is struggling to get the buy-in from the public sector or from the private sector.
Mr. Marx, so lastly, where to from here? What's the next step for Solidarity?
Well, from our side, obviously, our legal team is busy updating our documents. Remember when we did our parliamentary presentations, obviously, those inputs on the stance on the NBI and the bill at that stage was in the form of court documents. So we always knew that at some stage this will be tested in court. So it was never that it was not going to be tested. It was just a matter of time. But we still, like I said, we will be testing this in court. We do not believe that it's constitutional and that this legislation is actually unconstitutional. It's not affordable and it's not implementable. So from our side, we are preparing. We will take the matter to court. Even in previous court cases that we have done, we were joined by other professional organizations. And those were also, people dealing with the majority of the medical professionals in our country. And they are also registered with those professional organizations. And they all had the similar and same issue that we have as Solidarity. So I believe that many stakeholders will get on this. I believe that maybe medical aids will also get on this because, even out of the funding model, you would assume that people will continue paying their private medical health care. Obviously, they're not going to pay two different, institutions, and not even understanding what private health care is going to do in the future. I mean, what services will they render? Right. I listened to Nicholas Cripps as well, and he indicated, they will still decide and then look at the funding and things like that. Those were things that were supposed to be done already. If you don't have the money, how can you then buy a vehicle and then decide to drive it or learn how to drive it? You need to understand from day one exactly what is expected, where the funding is going to come from, and how we're going to support the national health insurance, which we still believe is not possible.
All right, Mr. Peirru Marx, thank you so much for joining us this evening. That was Mr. Peirru Marx, a medical sector coordinator at Solidarity, speaking to us there about their opposing of the NHI bill that was passed in Parliament this past Tuesday.